That morning cup of coffee. What could beat the smell and taste of it? A lot of folks I know can't get their day started without it. But it's not that way in a lot of the world. Take, for instance, Kenya. When you think of Kenya, some think of the beauty of its mountains, or the lush green fields of coffee and tea. Perhaps some have read of the large crops of sweet potatoes and sugar. But when some think of Kenya, they think of the abundance of wildlife. Wildlife that's not always kind to watch, and in a lot of cases, it's very hard to watch. We in the U.S. live a reasonably comfortable life. A lot of us enjoy the beauty of a sunrise on a pond. Or how about the splendor of a sunset over a body of water? Remember the lion gnawing on a bone earlier? While it is a fact of nature, it seems to be difficult in some ways to watch. But there is a greater tragedy. That's the tragedy of the loss of human life. This tragedy is in a lot of cases avoidable. I say that because it's avoidable for a number of reasons. Consider this. In the few seconds it took you to view the cup of coffee being poured in the beginning of this video, a child in Kenya contracted malaria because of a mosquito bite. A mother is nearing death because she couldn't get the care she so desperately needed during the birth of her child. Children all over this region missed a meal, and some didn't have any food to eat today. Of the 223 countries listed in the CIA World Factbook, Kenya ranks 72nd, and UNICEF states that the mortality rate among children in Kenya 5 years of age and younger ranks 35th in the world. But also consider this. The people of the area are especially hurting for several other reasons. There are 100 times more pregnancy-related deaths in Kenya than in the United States. Infant mortality is 10 times higher in Kenya than in the U.S. Nearly 40% of Kenyan children under the age of 5 are malnourished. Outpatient and admission wards in the Kakamega region are overcrowded with patients. Public facilities in the Kakamega region suffer from serious shortages of medical supplies and equipment. Clinics in this rural area lack many supplies, such as stethoscopes, blood pressure cuffs, bandages, syringes, disinfectants, thermometers, antibiotics, and ibuprofen, which are readily available in any clinic or hospital in the United States. These shortages, including even simple anesthetics given during a surgical procedure, add to the unnecessary deaths in this region. Malaria, HIV/AIDS, lack of prenatal care, and vaccine-preventable diseases in children worsen the problem. But the problem is being addressed. A group of concerned individuals, headed by Dr. Margaret Kaliwa, have formed an organization called Tropical Clinics. Born in Kenya, Dr. Kalibra has been living in the United States for the past 23 years, but she never forgets her African roots or the plight of her people. This New Jersey-based organization has sourced much of the needed medical supplies to ship to Kakamega. These medical supplies could be shipped very shortly, except for one thing: a lack of needed funds to ship them there. You can make a difference in this rural community by helping us provide much needed health care. Won't you consider giving us a hand in getting these supplies to Kakamega? Visit our website at www.tropicalclinics.org and make a donation today. Once you've helped us, sit back and enjoy that cup of coffee, knowing that you are making a difference in the lives of the precious people in Kakamega.